In 1917, mustard gas was first used in World War I. It wasn't until 1943 that a U.S. ship carrying mustard gas bombs that exploded in Italy caused scientists to observe severe bone marrow suppression and almost no white blood cells in survivors. Researchers then deduced that if this gas depletes white blood cell counts, maybe we can use it to treat white blood cell cancers. This led to the first ever in-human chemotherapy trial, which was done by Yale pharmacologists Lois Goodman and Alfred Gilman, who modified the compound to make it safer and tested on a patient with advanced lymphoma, which led to the birth of modern chemotherapy. They belong to the general group of alkylating agents, which involves the drug acting as an electrophile, covalently reacting with DNA, which acts as a nucleophile. When DNA is alkylated, covalent crosslinks form between bases on opposite strands. Normally, helicase separates DNA by breaking weak hydrogen bonds, but it cannot break these much stronger covalent bonds. As a result, the DNA double helix cannot unwind to form a replication fork. Without exposed single-stranded DNA, DNA polymerase cannot synthesize a new daughter strand, and DNA replication is blocked. .xt. This usually leads to failed repair mechanisms that hopefully lead in apoptosis. We consider these cell cycle non-specific agents. How does this happen? These alkylating agents have what we call an activated carbon, which means there is an electron withdrawing group attached to a CH2 group. This pulls electron density away from the carbon, creating a partial positive charge on the carbon. DNA has a lone pair, usually N7 on the guanine, that acts as a nucleophile and attacks that partial positive charge. The leaving group then leaves, and alkylated DNA is the result. Okay, now on to the actual nitrogen mustards. All nitrogen mustards contain the same chloroethylamine or bis-beta-haloacylamine backbone. Or you can say that nitrogen mustards contain a central nitrogen flanked by two V-chloroethyl alkyl chains, which act as leaving group-terminated alkyl arms that enable DNA alkylation. Or, think of it this way. We put mustard on sandwiches, right? Think of the pharmacophore as the mustard core, which is the nitrogen and R group are pretty much sandwiched between two chlorines. So what do the R groups usually look like? One important thing to be thinking about with these nitrogen mustard R groups is that tertiary amines are usually protonated at physiological pH. Remember for later that we need these nitrogen mustards to be uncharged in vivo, because we need the free lone pair on the nitrogen in order for them to work. To compensate for this, most R groups are designed so that the nitrogen can keep its lone pair free by attaching electron withdrawing groups to pull electron density away from the nitrogen. This lowers the pKa, making the nitrogen less basic. Remember, if the pH is lower than the pKa, the nitrogen favors protonation. By lowering the pKa, the nitrogen is less likely to be protonated at physiologic pH. The main issue with designing nitrogen mustards is finding the right balance. The drug has to be reactive enough to attack DNA, but if it is too reactive, it will start reacting with everything in an aqueous environment and cause a lot of off-target toxicity. The main issue with designing nitrogen mustards is finding the right balance. The drug has to be reactive enough to attack DNA, but if it is too reactive, it will start reacting with everything in an aqueous environment and cause a lot of off-target toxicity. For example, see the structure of chlorambucil. This guy has an aromatic benzene ring which does exactly this. Okay, cool. But how does this allow for DNA alkylation? Step 1 of the reaction would be the molecule reacting with itself to form a cyclic aziridinium ion. Here is the activation step, where the lone pair on the nitrogen attacks its own beta carbon in an SN2 reaction. Chloride is a good leaving group, so it leaves, and a 3-membered ring forms. This nitrogen now has a positive formal charge and is highly electrophilic. What do we remember? These alkylating drugs act as electrophiles. One of the DNA nitrogens, usually N7 on guanine for these agents, acts as a nucleophile and can attack this activated electrophilic center. Step 2, simplified, would be this N7 on the guanine molecule on DNA attacking the aziridinium ion, producing an alkylated purine. Remember we said the mustard was sandwiched between two chlorines? Well, the second chlorine reacts to form the aziridinium ion in the same way. The product looks like this. This then can attack another N7 on another guanine molecule, resulting in covalent cross-linking. Like I said earlier, the cell then can't replicate, and hopefully either some checkpoint kinases or P53 detects that damage is too extensive repair and triggers apoptosis. There are many nitrogen mustards on the market, but by far the most common is cyclophosphamide. Cyclophosphamide is an inactive prodrug that needs to be converted to its active form in the liver, which lowers its GI toxicity. Once it's converted to its active form phosphoramide, it also produces an extremely toxic byproduct called acrolein. Acrolein, which is in the bottom left here, accumulates in the bladder and can alkylate cells and cause hemorrhagic cystitis, which results in painful and bloody urination. No other nitrogen mustards cause this aside from cyclophosphamide and ifosfamide. Here are the structures of cyclophosphamide and ifosfamide, which we can be metabolized to the toxic byproduct acrolein. So when we use these two drugs, we need to co-administer with another drug called masna, which essentially neutralizes the acrolein. The mechanism is shown here. So in summary, nitrogen mustards are classic DNA cross-linking agents that work by forming aziridinium ions, selectively killing rapidly dividing cells. I will go more in depth on how the ADR mechanisms occur across all alkylating agents if I have the time in a later video.